I'd like to talk about the valuable service currently provided by Dublin Fire Brigade in our capital city, and also to discuss the current review of the ambulance services nationally. The Dublin Fire Brigade ambulance service has operated over 100 years at this stage. Importantly, the Dublin Fire Brigade performs a dual role service, and for those who don't know what that means, it means either an ambulance or a crew of a fire appliance can arrive at the scene and stabilise a patient until an ambulance arrives. As a result of this dual role and the brave work of Dublin firefighters, Dublin has one of the best survival rates of out-of-hospital cardiac arrest in the world. Dublin Fire Brigade is most definitely a first-class example of a fire-based emergency medical service, which is internationally recognised as best practice. This model is also used in many other cities throughout Europe, such as Paris, Dusseldorf, Frankfurt, and also in places like New York and Detroit in the United States of America. At the moment, the HSE pays about €9 million, I believe, for the Dublin Fire Brigade to deliver this vital service to our capital city. Now, apparently this amounts to less than 7% of the total national budget for ambulance service, even though Dublin Fire Brigade respond to almost 40% of ambulance calls nationally. I suppose as a Dublin TD, I've been contacted by many fellow citizens from all sides and people from within the fire service, and people I know within the fire service as well personally, around the HSE plan from March 2013 and the current joint review of the Dublin ambulance services underway by Dublin City Council and the HSE. Minister, this HSE plan from last year, details of which were revealed in the Irish Times recently, states that plans to take control of Dublin ambulance service from Dublin Fire Brigade by the end of 2015. There are two concerns from the firefighters that the review currently underway will recommend this plan and not consider the exemplar service provided by the Dublin Fire Brigade, which I mentioned already. Minister, I'm out of time, but really the question I want to ask is, basically, you know, I value the Dublin Fire Brigade service and the ambulance service that they offer, and anybody who lives in Dublin or receives the service that they offer, no, it is the best service that we have in this country. And the bar of what the Dublin Fire Brigade services do from the ambulance point of view is where the bar should be set for all ambulance services throughout the country. And I'm fearful as a citizen, wholeheartedly and genuinely, and I know, Minister, in Swords it's covered by Dublin Fire Brigade as well, that any changes to the way we run our ambulance service nationally and for it to be taken control by the HSE, I'm just concerned that the value and the bar that has been set by Dublin Fire Brigade running the ambulance service in Dublin will be jeopardised. And I ask that any review that's carried out, that this must be acknowledged. It's the only ambulance service, I believe, that almost reaches the HICWIT standards, even though it doesn't even have to abide by the HICWIT standards. I'm aware that somebody else is speaking as well on this, so I'll leave it at that. Thanks.
Thanks, Deputy Kelleher.
Yeah, thanks, Chairman. Just to say at the outset, I welcome the opportunity to speak on this particular issue. And I think, Minister, when you look at the leaked report that broke over the St. Patrick's weekend regarding the HSE's plans to take control of Dublin's ambulance service from the Fire Brigade, you can ask two questions. The key question, of course, is why? And is it the right train to follow? And the two reasons that the report seeks, the HSE is seeking to remove the emergency ambulance provision from the Dublin Fire Brigade on two key points: a lack of HICWA oversight and on cost. Now, you see, Minister, the difficulty here we have with this is that this particular report was carried out by the HSE itself. And the fact that they are the ones drawing up the report would indicate that at the very least they may be partisan or biased in regards to this particular issue. And at the very least, I would suggest, Minister, I would genuinely suggest that there would be an independent assessment as to whether or not this would be the right thing. Because as Deputy Lyons has pointed out, nobody complains to us, and I am quite sure nobody complains to you, Minister, about the actual ambulance service and being provided through the Dublin Fire Brigade. It is one of the most efficient. If you look at the basic cost analysis and breakdown, they seem to be very cost efficient. And I'm just concerned that we now have something that actually is working reasonably well, being taken over by, should I say, Minister, an organisation where the ambulance service nationally isn't working very well. We've had the most catastrophic incidents throughout the country with regard to wheels falling off ambulances, children being locked in ambulances, delays sending ambulances, dispatching ambulances to the wrong county, people being taken from county to county to county after they break their leg at a football match in Carlow. By the time they actually end up in hospital, they have been throughout the South East. So there is inherent difficulties. And I know, Minister, you've acknowledged that and you've requested HICWA to carry out a full audit. But in the meantime, the very least that the Dublin Fire Brigade deserve is an independent assessment of the service they provide, because by and large, as Deputy Lyons has highlighted, the vast majority of the people in Dublin are satisfied with the service provided by the Fire Brigade. So I would ask that you would request independent audit and verification as opposed to relying on the HSE to carry out a cost analysis. And regarding the oversight, I'm quite definite, Minister, that could be addressed with regard to HICWA by legislation or maybe even statutory instrument.
Thank you. Minister, 4 minutes to respond.
Thank you very much, Catherine. And I'd like to thank the deputies for raising this matter, which I know has been the subject of some speculation recently. And I welcome this opportunity to clarify the matter for the House. Dublin Fire Brigade provides emergency ambulance services in Dublin City and County by arrangement between the Dublin City Council and the HSE. The HSE National Ambulance Service also provides some emergency capacity in the Greater Dublin area, as well as non-emergency patient transport. The ongoing development of pre-hospital emergency care involves a range of initiatives. This includes the development of a single national control and dispatch system. The new national system will deploy all emergency ambulance resources in the state, including emergency ambulances, rapid response and intermediate care vehicles, first responders and aeromedical services, as well as ambulances in Dublin. This move to a single dispatch system will represent a significant change in clinical governance, as Dublin Fire Brigade currently dispatches its own ambulances. The Dublin City Manager and the HSE's Chief Operating Officer have therefore commissioned a joint review of Dublin Fire Brigade ambulance services in Dublin City and County. So I hope, Deputy Kelleher, you heard that bit. Good. So it's not just a HSE review. The review will consider all aspects of ambulance operations provided by the Dublin Fire Brigade in Dublin, including capacity and the capability of ambulance services. The review will inform consideration of the optimal and best value model for provision of emergency medical services in Dublin. It is part of the process of ensuring a clinically driven, nationally coordinated system supported by improved technology so that emergency pre-hospital care can continue to modernise and services can be delivered in an appropriate and timely manner to the benefit of all patients. I'm aware that concerns have been raised about this review, with suggestions being made that it should be suspended or cancelled entirely, and that there's no necessity for a review as the Dublin Fire Brigade ambulance service is operating in a fully satisfactory fashion. I want to assure the House that I'm fully aware and appreciative of the excellent historical tradition of the service provided to the citizens of Dublin by the Dublin Fire Brigade, and in fact I can attest to that myself in a previous life as a GP in North Dublin. This review should not in any way be interpreted as a criticism of that service. We are obliged, however, to ensure that pre-hospital emergency care across the entire country is ready to meet the challenges of the future, and this review has been carried out with that in mind, and I look forward to the outcome of the process. Thank you.
Thank you, Minister. Just a short supplemental.
Okay, great. Thanks very much. Minister, I appreciate your comments there. I suppose, look, the biggest thing I really want to say is that unlike a lot of TDs who come in here, I don't go, running around the house shouting concern too often. But on this one, I genuinely feel concerned. I'm concerned that we're going to throw the baby out with the bathwater here. Dublin Fire Brigade said it already, the most impressive and exemplar fire service we have in the country, who operates a fantastic, efficient and cost-effective ambulance service for Dublin City, the one that every other citizen in this country should have. And I'm just a little bit concerned, to say the least, that any plans for the HSE to be involved in running the service will throw the baby out with the bathwater. And I ask all that can be done, and the Fire Brigade officers and ambulance officers who are joint officers do what they can, are heard and their voices are heard properly. But most importantly, the baby is not thrown out with the bathwater, and I really do have concerns as somebody who may need that service in the future, and I have complete confidence in Dublin Fire Brigade delivering that. And unfortunately, the stories I hear from other places, and I have a brother who's in the National Ambulance Service, they are a little bit daunting, unfortunately, and I want everybody to have the best service, and Dublin Fire Brigade offer the best service.
Chair, just to concur with Deputy Lyons, and just to say that, look, I mean, we all accept, and I accept the veracity of the Minister's statement, that it is not a criticism of the service provided by Dublin Fire Brigade. And I also note that it's the Dublin City Manager, in conjunction with the HC, carry out this report. It's not that I would question anybody's integrity in this issue, but I just think a complete independent evaluation would be the very least I mean, who's to say that the Dublin City Manager or the Dublin City Council, would not be encouraging a hive off to some other organisation of this particular service? I think that the least they deserve is an independent assessment. The cost that is in terms of breakdown would suggest that the Dublin Fire Brigade provide a very efficient service, an exceptionally efficient service. And when you look at the difficulties and the complaints nationally, most of the complaints derive from elsewhere, Minister, from outside of Dublin as well. So maybe we should just look at that as well. So look, all I can say is, could we have an independent assessment carried out to assess whether or not moving the Dublin City Fire Brigade ambulatory service under the HSE would in effect make any difference or would compromise or enhance? And I think that would be at least something. But in general, as I said, people have not expressed any complaints with regard to this, and certainly the issue of HICWA oversight, I think, being honest, is a red herring. They already subscribe to that in terms of their commitment to providing a service, and I'm quite sure that with a small tweak in legislative proposals or statutory instrument, that this Dublin Fire Brigade could also be brought under HICWA oversight with regard to meeting the guidelines as laid down by HICWA.
Thanks. And the Minister to respond briefly.
Thank you, and I'll be brief. Just to thank the deputies again. Look, I can understand Deputy Lyons' concern around what is an excellent service and anything that he might construe as to impair that. Far from it. This is to improve the service. And it may transpire that this report comes out with unexpected findings that people in this House are presupposing. But I would make one point. I mean, it wouldn't be fair to compare an urban service like what we have here in Dublin with rural services and the big distances that have to be travelled and the number of hospitals available and the density of population, etc. What is happening here is a review. Let's await the outcome of that review, and I believe we should revisit the situation at that point in time and give everybody in the House an opportunity to engage at that point in time. The ambulance service in Dublin is a critical part of the infrastructural services within the city. It has a long and proud tradition of delivering, and I wouldn't want to see anything happen that would interfere with that. But at the same time, I am a believer in not accepting the status quo if it can be improved. And I don't believe there's any service that can't be improved. So I don't think, having said what we've said here, and I think there's unanimity here in the House on this is an excellent service. I don't think they've anything to fear from a review, other than to see maybe how we can further improve it. But I mean, let's not prejudge the outcome. Thank you.
Thank you, Minister.